Hello, dear friends. This is Coach FO. My name is Fentola Onogurua. Welcome to this channel. This is the Higher Health Veil. That's the name of this YouTube channel. Please subscribe if you get value in this video. Today, we're looking at prostate cancer and sex. What are the effects of prostate cancer in the bedroom? That's what we're reviewing today. Now, prostate cancer is a type of cancer that affects the prostate gland, which is a small walnut-sized, walnut-shaped gland located below the bladder in men. It's the part of the marvelous plumbing system that God has put in the man. So it's below the bladder. It occurs, prostate cancer occurs when when abnormal cells in the prostate gland grow and divide uncontrollably. That's the word. It divides uncontrollably, forming a tumor. Prostate cancer is one of the most common cancers in men and usually develops slowly over time. Illnesses does not happen overnight. It takes years to grow. So as soon as you begin to experience the symptoms that I will outline here, please seek medical help. A lot of men are nonchalant about their health. They don't even observe anything wrong until it becomes a fire brigade matter. Don't be that person. Become self-aware, understand how you are made up, and observe any little changes. Causes. The exact cause of prostate cancer is not known, but there are certain risk factors which we call predisposing factors, and those I'll outline 4 for you in this video. Number 1, age. Once a man is 40 years old, the prostate gland starts enlarging. That is like natural. These days, we have younger men having that enlargement in their 30s. In fact, as we speak, we have issues with guys in their 20s. And this is happening because of our lifestyle. We've gone so far away from the lifestyle that our fathers had. We've gone so far away. And so this unhealthy exposures is predisposing us to early, sicknesses. So once you're over 40, please make it a point of duty to do your PSA test regularly, like every 6 months. Worst case, every year. Early diagnosis is better so that it can be easily managed. So age, the risk increases with age. Number 2, family history. If any of the male relative you have already has prostate cancer, please, it means that you have the potential. When we say predisposing factors, it means there is a possibility for you to have. Please don't wait for it to happen. Be conscious of it, be aware, and begin to take steps to avoid it. So it increases the risk. So genetic factors may play a role in some cases. So that my mother was fat, that my father is fat, does not mean I will be fat. It means I have the potential to be fat. That obesity will happen if I live the same lifestyle that they lived. But now that I know what made them grow that fat, I will consciously, avoid those things, adjust my lifestyle, and then I don't have to be fat. Almost everybody has the potential to be fat. The same thing goes for prostate cancer. Number 3, race and ethnicity. Are you a black man, an African American? You are susceptible to developing prostate cancer. It is more prevalent in African American men and less common in Asian and Hispanic men. Our genetic makeup predisposes us both to high blood pressure and prostate cancer. So we have to be more careful. What is it that we are eating in this part of the world that is predisposing us? We need to begin to do research in the right way so that we can avoid all of that. Number 4, the diet and lifestyle. How are we living? I mentioned earlier, these days we have younger guys having high blood pressure in their 20s. And in their bid to manage the high blood pressure, they begin to have erection problem. because they are using antihypertensive drugs that naturally relaxes all the muscles in the body. So it has an effect on the reproductive system, on the urinary system. Those two work together, especially in the man. So what lifestyle? When do you sleep? What time do you go to bed? Sleep is called the beauty sleep because it is when you sleep that your body repairs itself. So we need to look at the diet and our lifestyle. A diet high in red meat and high fat dairy products, as well as a sedentary lifestyle. Do you do exercise or you just wake up and sit down? All this may increase the risk of developing prostate cancer. Those are the risk factors. We are all susceptible to all of this. Please be more aware, be more conscious, reduce all these risk factors. Meaning, don't just sit down without moving about, don't sit down without moving your body. You need to move the waters in your body. It's important. Don't just sit down like a lake. It's a lake that is stagnant. And when you see a lake, dead things fill up a lake. Nothing that lives in a lake can live because the water is not flowing. The water in your body must flow, and that's why you must do your exercises. Some of the symptoms. So if you have begin to notice these symptoms, please get to the healthcare facility on time. You can also send me a DM and we can work with you. Please subscribe to this channel for more information. As you get value, tell your friends, tell your family members. We are out to help the men. Don't just work hard and then die. The women want you to be around for a long time. So some of the symptoms you will observe, because as the disease progresses, at the early stage, you may not notice anything, and that makes it more dangerous. But as the disease progresses, the following symptoms may occur. One, frequent urination. How often were you going to toilet, especially overnight? Especially at night. How many times do you now go? So you need to know that, and you need to be observant. If you used to go 2-3 times before and now you're going 5-6 times, it means it has doubled. So please get to the hospital and do the necessary PSA test for early diagnosis. Number two, difficulty starting or stopping urination. It means that the sphincters that are controlling your urination, the bladder, one is inside, one is external, are becoming weak. Is one of the signs. Weak or interrupted urine flow. When you're younger, if you want to wee, you can put up your manhood and the urine will go far. In fact, children used to play with that among themselves. But now it's difficult to even get the urine up. You find that its dribbling is low, is weak, and then it's interrupted. It comes, stop, come again, and stop. That means there is a problem with the control. Number four, look at there is blood in the urine or semen. Blood in the urine. When they do urine analysis for you, the lab will tell you that there is blood. And then in the semen, check your semen often. Tell your partner the tissue that she uses to clean, examine it. Tell her to examine it so that if there is blood in it, she will see it for you. And please know, you need to be open and honest with your partner. It's important that you let her help you. The challenge we have, especially in this part of the world, is that our men are so men or manly that they don't listen a lot of times to their wives. Please listen to her. She loves you and she has your best interest at heart. So pain or discomfort in the pelvic area. The pelvic area is your waist. There is a flat muscle plan, just like that. The pelvis, there are muscles there that acts that is like a plate, just flat like that. When you begin to have that pain or discomfort, then there's trouble. And that's why when you as a man, you're doing exercise, please exercise your pelvic muscles. It will help to firm up all those sphincters that we're talking about. Erectile dysfunction, that's the major effect in the bedroom. So you are now finding it difficult to have erection. Please open up to your spouse. Don't just take it in your stride. Don't just think you want to start self-medication. The problem comes when you are now doing self-medication just to have an erection. Please don't do that. Seek medical help immediately. Bone pain, especially in the spine, the hips, or ribs, it's indicating advanced cancer. So I've mentioned 7 symptoms. If you are experiencing any of this, even 1 or 2, please get to the hospital. Let the surgeon see you. It's usually under the case they will refer you to a surgeon who will examine the glands and tell you if it's prostatitis or if it is uh, BPH, which is the enlargement of the prostate gland, or if it is now prostate cancer. You need early diagnosis to be able to manage. In our next video, we will be looking at the holistic approach to manage prostate cancer. Don't miss it. I love you. Your wife love you. All the women love you. We want you to be around for a long time. Wait to enjoy the fruits of your labor. God bless you and have a great day. Bye bye.